Good morning, everyone. On behalf of the Center for Occupational and Environmental Health, I'd like to welcome you to this webinar on the topic Health and Employment, Macro Context and Micro Initiatives, presented by Drs. Ed Yellen and Christina Banks. But first, I'd just like to share a few housekeeping items. During this presentation, you'll be muted, so if you'd like to ask a question, please enter it into the Q&A section that you see on your screen. At the completion of the presentation, the presenters will spend about 5 to 10 minutes in Q&A, but you can enter your questions at any time during the presentation and we'll save them to the end. CE credit is available for registered nurses and may be available for industrial hygiene credits. If you want to obtain credit, you need to register again at cerehce.org and also complete the evaluation for the webinar. You'll then be emailed your certificate of completion. After today, the webinar will be archived and a link also provided at cerehce.org. Please also do complete the evaluation for today's webinars. We appreciate the feedback. Our presenters have no financial interests to disclose. At this time, I'm very pleased to welcome our speakers for today, Dr. Yellen and Dr. Banks. Our first speaker is Dr. Yellen. He's been on the faculty at UCSF since 1980 with joint appointments in the Philip Ali Institute for Health Policy Studies and in the Department of Medicine, Division of Rheumatology. Thank you very much, Dr. Yellen, and welcome.
Relationship between health and employment. I'm going to talk a little bit about how people with health problems have fared in the labor market and what are some of the changes in employment that affect them. And I personally have nothing to disclose. Employment of people with disabilities periodically becomes an important policy issue. Not usually for the right reasons, not usually because we care about their employment. Instead, it's concerns about growth in the number of beneficiaries of disability compensation systems, of which the largest is SSDI, Social Security Disability Insurance. Concerns are heightened by the aging of the population, which puts increased fractions of people at risk of disability. And it's fueled by the inherent subjectivity of classifying people as disabled. This was highlighted about 3 years ago by the This American Life episode, where the examples of people doing physically demanding leisure activities while collecting disability benefits. Disability policy is a Rorschach test. Many see disability compensation systems as enticing people out of work with high income replacement rates, a middle-class version of the welfare queen trope that we see often from conservatives. Others view this in epidemiologic and demographic terms, simply the result of the fact that more of us are older and therefore at risk for the disabling conditions of aging. Another way to view trends of employment of persons with disabilities is as a result of changing labor force dynamics. This is more my view. Reality probably incorporates elements of all three views. Disability compensation is a nice alternative to welfare and a bridge to Social Security retirement. Declining mortality may result in increased rates of chronic disease, and there is a push out of work for certain parts of the labor force. Now I'm going to turn to disability compensation dynamics in the US. The history of Social Security Disability Insurance, or SSDI, before it was enacted, it was part of the progressive agenda. So it's been there for close to 100 years in public policy debates. was not included in the original Social Security legislation out of fears expressed by private disability compensation companies that it would lead to moral hazard. This was said in the height of the Depression, of course, moral hazard being that people would not want to work when the option of getting disability benefits existed. The program was enacted in 1956, first as a way of freezing access to Social Security retirement benefits, then in 1960s, actual compensation until then. It was reformed numerous times to deal with the growth in the program. The number of Social Security disability insurance beneficiaries in millions is shown on this slide for the last 45 years. And the number has increased from 2 million in 1970 to over 10 million at the current time. So there are 10 million people of working ages who are SSDI beneficiaries now. The ratio of the number of beneficiaries to the number of people who are insured by nature of paying into the system at any one time has also increased. So you can see that by 2015, an increasing proportion of the people who were of working age and paying into Social Security, 5%, were getting benefits, as opposed to between 1% and 2% 45 years ago. The application for SSDI benefits ebbs and flows, but in general has gone up from 1 million a year to close to 3 million a year, despite the recent downturn, which probably occurred as the economy recovered from the recession. But the number of people awarded benefits is always smaller than the number who apply, but that's gone up too, from about 0.4 million a year to 1.2 million or so until the recent downturn. The ratio of the number of people awarded benefits to the number of people who applied has ebbed and flowed also. But what you see is if you draw a line across the scraggles up and down, roughly a third of people who apply for benefits over time get them. And there's recently actually been a downturn in the proportion of people who apply for benefits and actually receive them. So efforts to tighten the number of people who are gaining into the program have been successful. The ratio of SSDI benefits to average earnings is showed in this slide for 1970 through about 2015. And what you see is that this is the so-called replacement rate. What proportion of average earnings are replaced by the benefits? And it's roughly now stabilized for the past 20 years or so at something like a third of earnings, average earnings. So the program pays more than welfare, but it pays only a third of average earnings. It's not a king's ransom, but it's a decent level of benefits for people whose alternative is nothing or welfare of some kind. So how do we explain these dynamics? There's the economist model of disability, and what that model hypothesized is that a worker with impairment weighing his or her options will leave work now, and because of the way the program operates, they must wait 6 months after they leave work to apply for benefits, knowing that the decision on the application will not come before another 6 to 9 months. That's not part of statute, but there's a backlog. And they will ultimately have a 1/3 chance of success, and if successful, will replace a third of their earnings, which I just shown you before. So the expected return is actually pretty small. It's a third times a third, or 1/9 of current earnings, with no disability income for at least 6 months and probably 15. So that's the problem with the income replacement model. It's not a particularly good gamble when seen in prospect. what are the structural models of disability? They're based on the erosion of the physical basics of work, which removes the brute force requirements as deciding factor in most cases. So what becomes crucial now is the control over pace of timing of work activities that are now central to employment. More of the population has odd shifts, night shifts, rotating shifts. Melding the rhythms of work with the cyclical rhythms of chronic disease and its care becomes problematic then, especially when we have two-career families being common. And what are the tasks of work that are demanded in the contemporary economy? Increasingly, it's the ability to concentrate and communicate more important than the brute force physical requirements of jobs. And that's resulted in the emergence of mental and neurological conditions as the most prevalent causes of Social Security disability insurance entitlement. The more macroeconomic version of this focuses on the changes in the nature of the workforce over time. And it's based a little bit on dual market theory, which posits that people with disabilities like women, older workers, and members of racial and ethnic minorities are relegated to a secondary labor market. They're the last hired in a boom and the first fired in periods of stress in the economy, like the recent recession. They're also less likely to secure jobs in high-wage growth sectors of the economy. In a very short wave, they're more affected by cyclical downturns and upturns in employment than those who have more secure positions in the labor market. Over the longer term, they're more likely to be displaced from declining industries and less likely to obtain work in rising sectors of the economy. So now I'm going to turn a little bit to disability dynamics to put together what the long-term trends have been for people with disabilities in the economy. Disability is defined in the National Health Interview Survey, from which these data derive, as a limitation in activities. They changed the definition slightly about 2 decades ago. So when I show the following slides, it's best to view trends as up to 1997, and then again after that year. 2 measures are traditionally used in employment metrics. Whether or not somebody is in the labor force or not, that includes the employed and those who are actively looking for work, the current official definition of unemployment, and the simple question of whether you're employed or not. The analyses here focused on jeopardizing characteristics, as I mentioned earlier, including gender, race, age, and disability defined as a limitation activities. Each of these characteristics is protected by civil rights legislation. So I'll start with the proportion of the population reporting disability defined by activity limitation. The percent with limitations in the United States by gender for close to 45 years is shown in this slide. Men are the pink and women are the dark red, and they basically track each other. So you can see in 1997, there was an artifactual change in the definition of limitations, but overall, there's been no strong change by gender in the proportion of people who say they're limited in activities. But there are differences by age. Here we look at the percent of men with limitations in the US over the period of time covered by the chart by age. For men with disabilities, there's been a significant worsening of their, and there actually has been a decline in proportion with limitations over this time and not much trend for the other age groups. So that addresses the question, at least with respect to men, are higher rates of disability driving, of limitations driving more people out of the labor market? And that argues, because the data don't indicate that, at least particularly for the men at the age of highest risk, they're actually declining per fractions reporting limitations. So the health of the labor force doesn't seem to be central to these dynamics. Looking at women, the same thing is true, particularly for older women. There's no overall trend over time in the proportion who say they're limited in activities and therefore would be at risk of leaving employment due to disability. So health isn't driving the argument here. Now we're going to turn to how well people with disabilities actually fare in the labor market, looking at labor force participation rates. Overall, and this is not stratified by disability status in this slide, you see that for men, and this is well documented in the press, overall men of working ages have seen a substantial decline in the proportion who are in the labor market as of 2013 compared to 1970, and that trend has actually continued since. Women, on the other hand, particularly early in it, saw their fraction of the women in the labor market of working age had increased dramatically before leveling off. And when you combine the two, there's been an increase in the earlier period and then a flattening in the labor force participation rate of both genders. But now we're going to turn to the how those dynamics differ for those with and without limitations. Among those without limitations, employment rates have actually, labor force participation rates have actually increased over time from 72% to over 80%. Whereas for people with disabilities, the situation has actually worsened from 52% in 1970 to about 32% in 2013. So what we've seen is a worsening of the employment of people with disability, despite the fact that there aren't higher rates of limitation over time. Looking just at men, the situation is quite stark. For men with disabilities who are limited, the proportion in the labor force has declined from 80% to about 55% over this time, and there's been essentially no change among men without limitations. This is for younger workers, those 18 to 44, younger men. For those ages 45 to 54, the pattern is similar for men by limitation status, although where it hits the y-axis is different, obviously, for people at different age groups. But there's been a tremendous drop-off in the labor force participation of men these ages with limitations from 75% to under 40%. And for older men, the situation is a little different. It's the labor force participation rate has declined slightly for men without limitations and declined substantially from 55% to about 20% for men 55 to 64 with limitations. For women, among younger women, of course, without limitations, there's been a tremendous increase over this time in labor force participation. For women with limitations, the situation improved in the early part of the period, but has been worsening quite substantially since. For middle-aged women, the situation has continued to improve for those without limitations. And for women with limitations, there's been a slight drop-off, particularly since the turn of the century for middle-aged women in the labor market with limitations, a situation that we would not like to see, of course. For older women, there's been tremendous improvement for women without limitations, but for women with limitations, there's been essentially stasis. So overall, we see that there's a divergence in the experience people with and without limitations for both genders over time. So summary and conclusions. The aging of the population doesn't necessarily result in a pandemic of disability and reductions of employment. There are no clear-cut trends in disability rates, the activity limitation slides I showed earlier in my talk, over the last decade or so. Definitive proof that income replacement entices people to leave work is impossible because you can't randomize people to different income replacement rates. But logic indicates that premeditated action to leave work would not be rational because there's a 1/3 chance of getting awarded benefits if you apply, and you'll have only 1/3 of the income, and you'll have to wait something like 15 months to get the decision. So 1/9 chance, 1/9 probability of a better outcome for an individual who applies. Disability would appear, like gender, age, and race, to jeopardize employment. Women with disabilities are less likely to see increased employment rates, and men with disabilities are more likely to see decreased employment rates. Reducing benefits is therefore unlikely to stem exits from employment among people with disabilities because of the data I showed on income replacement. But reducing the benefits will cut the income of 10 million Social Security disability recipients and their families. It'll hurt a lot of people and probably not stem exits from employment. A focus on economic growth, training, and anti-discrimination legislation is central to improving the employments of people with disabilities because it's not limitation that's driving the increase, but it seems to me it's the way people with health problems interact with our economy and are suffering from heightened rates of job displacement given the kinds of things, the kinds of industries that are shedding workers. Great. Thank you very much.
Thank you, Dr. Yellen, for that presentation. At this time, we're going to switch over our presenters, and Dr. Banks is the director of the Interdisciplinary Center for Healthy Workplaces, where she leads an interdisciplinary team of scholars and practitioners in innovative research projects and distribution of state-of-the-art information regarding the development and implementation of healthy workplaces. She's also a lecturer here at UC Berkeley at the Haas School of Business. A reminder to everybody to ask questions. Our presenters will spend some time at the end answering, so enter into the Q&A section. And at this time, I'd like to extend a very warm welcome to Dr. Banks. Thank you.
Thank you, Julia, and I'm very happy to be here today talking with everybody who's virtually out there. I'm hoping to talk about something that is very exciting and actually is a potential way to address, successfully address the problems that Dr. Yellen brought up, which is how to make fewer people disabled. So my talk is focused on worker sustainability, but let me say a couple of things before we jump into the slides. The first thing I want to say is it's clear from Dr. Yellen's talk that disability is not a good deal for workers, and it also is not a good deal for society. Individual workers pay the price severely of disabilities that happen at work, and society carries the burden of those people out of work, both in terms of supporting them and also having fewer people in the workplace able to work and to produce. So that's the first thing I wanted to say. And the second thing I wanted to mention before I start is how I got into the business of employee health and well-being. As an industrial organizational psychologist, I've spent the last 40 years watching people work and how they work. This has given me experience over the years in terms of the decline of people's health and well-being as a function of the work that they are asked to do and also the working conditions under which they have to work. And it's well documented that the way we work today does make people sick and does set them up for injury and disease. So that motivated me to look at ways in which we could actually change the picture. So what I'm going to present today is really a framework for thinking about how we can address these problems. And then I hope I stimulate some of you listening to think about this carefully and how you might contribute to this change. So we are putting the framework of sustainability around the concepts of change that I hope to see in workplaces. And so let me just start with a couple of points about sustainability. What are the common definitions of sustainability? And we know these definitions from what we already are practicing in terms of raw materials and natural resources. So the definitions you see here are well accepted, and we have pretty good support systems for looking at the sustainability of natural resources. But does sustainability extend to workers? And so this is what's really important to think about. Can we also support the sustainability of human resources? So looking into what research there is on this question, and I gave you a reference at the bottom of the page here of one really key article that I think talks about this, is that when you have strong connections between work-life balance, well-being, and sustainability in the design of work and workplaces, you can have long-term effectiveness of employees over their working lives and enhance health and resource munificence of institutions and society. There is evidence that this exists. And employment practices that sustain work-life balance and well-being in the workplace, in workplace experiences, are critical pathways to long-term workforce effectiveness. So I'll actually tell you the conclusion of my talk before I get to it. And that is that health and well-being is the avenue through which organizations can achieve organizational success. It is what fuels productivity. That is not a well-accepted or well-recognized proposition. And secondly, ideally, organizations succeed most by having employees who want to come to work and can do their best work. So I'm starting with those conclusions as I go on with this talk, and I hope I can build to the point where you will accept those conclusions by the time we're done here. So what are the building blocks of worker sustainability? These have been identified as key pieces to sustainability. Obviously, these make sense. The work environment is caring and supports employee well-being. Employees are not seen primarily as resources that can be deployed and depleted to serve economic ends. And I want to put a special star on that one because many companies do implement a model of depletion and replacement. And that's because there is this assumption that there's an endless supply of fresh resources. I will challenge that assumption. Another building block is employees not faced with excessive workloads or an unrelenting pace of work for weeks and years on end would lead to sustainability. And employees who get time to recover or seek extra resources they need in order to perform in the future contributes to sustainability, and that burnout is avoided and employees are given time for renewal. Now, what company does all these things? So as I go forward, I'm going to try to give you some ideas for what we know and what we don't know. Where we are at this point. We don't know everything and we don't know enough, but this is what we do know. We know that interventions in order to improve employee health and well-being doesn't work under certain circumstances. Single-pronged approaches like single wellness programs or the introduction of ergonomic furniture just does not move the needle very far in employee health and well-being. Interventions that are not based on proven science and are a function of trial and error, they typically fail. Low participation rates have been seen in a lot of interventions that are put into organizations in order to address health and well-being. Low involvement and support of leadership and management is often associated with poor results. And the last one is when a high incentive value is attached to behavior change, you get people to change because, you know, if it's sufficient in the amount of incentive, you can get people to do that, but you only get compliance, you don't get commitment. And that behavior change is very short-lived and will go away as soon as the incentive goes away. So you might see articles where companies tout that their wellness program works because it's associated with some financial incentive, but we don't know and they don't report what happens when that incentive is taken away. So looking at the literature, we are understanding that there are some threads of commonality across scientific studies that have shown some success in increasing employee health and well-being. And I'm talking about looking across multiple disciplines. We have scientific evidence from public policy, public health, business, economics, psychology, sociology, environmental design, architecture, technology, nutrition, health science, occupational health, obviously. And across all of these environments, there is a thread. So we created a health and well-being model, which I want to present today and get your comments on it. The health and well-being model focuses on the employee's experience of the physical and psychological environment. It's really about how the employee feels and experiences environments that affect their behavior, because these different environments have elements in them that impact an employee's motivation and their ability to do their job. So our model explicitly acknowledges the role of employees' need satisfaction in explaining the relationship between different organizational attributes and employee outcomes. So the key to our model is, in terms of employee experience, is how they experience need satisfaction. One easy way to explain how that works is what is a commonly accepted equation, which is that job performance is a function of ability times motivation. And what this means is you have to have both ability and motivation in order to get high performance. Well, you get ability by good selection systems where you get people who have the skills to do the job, but motivation is often the weak link here. And so employee health and well-being directly impacts the motivation component of this equation. So let me tell you about the model. Okay, the person is nested in a series of environments, and the first environment that impacts people is the organizational context. What's the industry? What's the occupation? What's the financial status of the organization? How much do they invest in employee health and well-being or in the employees in general? The next environment is all of the things that organizations do to support employee health and well-being. And what could be part of this is actually the actual physical workspace. It could be organizational policies and procedures. It could be human resource practices. It could be the availability of healthy food in the cafeteria. So it's all the things that an organization creates and puts in place, could also be wellness programs, by the way, puts in place in order to support employee performance and health and well-being. And these organizational supports are designed to prevent illness, injury, and disease, mitigate conditions that currently exist, and promote health and well-being. And then the third nested environment is how individuals choose to work and live. So it's their eating habits, their lifestyle, what choices they make in terms of how they deal with their work demands and so on. So here you see the most nested circle, which is actually the person, how that person experiences these three environments. And we call them the physical and psychological states. And what we're talking about is their state of need satisfaction. And once we have positive physical and psychological states of satisfaction, we get healthier employees, we get improved personal and organizational outcomes, and we get organizational and societal sustainability. So that's our model. And let me tell you what are the basic needs that we have identified from the literature over decades of research in terms of what are the key needs for people to experience satisfaction. And so when I'm talking about need, I'm not talking about a person needing a sit-stand desk. I'm talking about things that are really basic to people and are wired to a certain extent inside us, where we are pulled to certain environments that provide positive satisfaction of these needs, and we are repelled or avoid environments in which there is dissatisfaction or a lack of satisfaction. So you can see that there are 8 here. Positive emotions are things like awe, love, pride, inspiration, hope, joy, and so on. That these are emotions that we are driven to experience, and meaning and purpose and belonging are key elements of our need satisfaction aligned with positive emotions. And then on the right side, you can see that this is about work-related needs, where we want to have work situations where we have control over the work we do and can actually accomplish what we set out to do. And on the left side, it's about how we, the conditions under which we work, where we experience personal growth, safety, which is both psychological and physical, and then physical vitality, which is the need for energy and to be energized. So what complicates the picture here is that in order to get need satisfaction from these key needs, it takes a village. Sometimes when I put up this slide, everybody says, this is way too complicated. It is complicated, and employee health and well-being, productivity, and sustainability is complicated. So what is meant by this slide is that all of these different aspects related to employee work and work environments play a role. They can play a role in creating conditions that detract from someone's ability to do their best work, or they can contribute to people doing their best work by providing situations or materials or resources that support need satisfaction. Okay, so when we talk about needs and how to fulfill those needs, it's very hard to tell an architect or designer build a company or build a design that where people feel meaning and purpose, or build a design where people can experience autonomy. So it doesn't directly translate. So we actually need a translator. And so what we came up with is looking at, again, the research evidence of what drives need satisfaction are a set of 7 things that we've come up with that you can actually design around. So these are design variables that we think organizations can use to begin the process of discussing with employees and discussing with parties that supply goods and services to companies. How would this be expressed? How will people feel these qualities in their work and in the work environment? So privacy is the first one. Privacy means that a person can have private conversations, perform work confidentially, be in a space without observation by others, and has control over unwanted interruptions or distractions. You can imagine that you could design for this and how important that is for people. Flexibility means a person can make choices in terms of how, when, where, and with whom he or she works, and the space allows for a wider range of work functions and arrangements to match their needs. So flexibility may be expressed in different work environments within the same organization. Predictability means that a person has the resources in a workspace that enables reliable and consistent workplace to match their needs. So predictability allows people to do their best work when they know what's going to happen and they have everything they need in order to be successful. Equity is defined as a person is allocated resources and space that generates a feeling of respect and fair treatment. Comfort means a person is physically and psychologically at ease and feels he or she has control over resources to meet his or her needs. Connection, it means a person has an emotional bond with others in the workplace and feels a sense of belonging. And then finally, safety is defined as a person feels physically and psychologically free from threats, hazards, harassment, and other forms of harm. Okay, so what can you expect from a carefully designed work environment? These aren't made up. These are all the outcomes that have been linked to environmental design arrangements and psychological policies and procedures and practices. So these are really are tried and true elements which promote employee health and well-being. Okay, so let me share some specific things that are associated with employee health, well-being, and productivity. So all of these items in this list have been empirically validated as having a positive impact. IEQ means indoor environmental quality. And by that, we mean things like what is the air, the temperature, the noise level, the smells, and the light. There is a lot of literature in this area which looks at different levels of each of these components and their impact on people's emotions, on their need satisfaction, and subsequently on their productivity. Views is another interesting feature, and what that means is people have views of nature. They can look outside a window and they can actually see a natural scene. That's important for refreshing the brain. When one is concentrating for a long period of time, the brain gets fatigued in a particular area of the brain that's working. And when you stand up and look outside to a view, that actually uses a different part of your brain, and it gives the fatigued part of your brain an opportunity to refresh and relax. Biophilia is a huge and growing area of of the components of employee health and well-being. It is the introduction of natural elements into the workplace. Easy examples are plants. but it can also be patterns of nature integrated into furniture or textures or walls. Water features, for example. That has been associated, not all of biophilia has been associated with positive emotions and positive responses to the work environment, and which improves resilience and immune responses to stress. Flexible work arrangements or environments, it also gives people choice and autonomy, and works well when people can go to work environments which matches the work demand. We know ergonomic furniture designed a certain way and adjusted appropriately has a positive effect on people's work ability. And a lot of that is to prevent repetitive motion injury and fatigue and other elements of disability or limitation that is due to a non-match or a lack of match between what the human body is capable of and what is being demanded of it in a certain work environment. This is also ergonomics in general deals with both a physical and psychological match between human capability and the equipment and technology with which they have to work. Reliable, available technology is critical in that most of the work that people do in office situations is heavily dependent on technology, and so having a reliable Wi-Fi and all the other technology equipment and devices are critical for people being able to do their work. Access to healthy food. This is a big issue because it also involves worker change, habit change, which is very difficult, but easy access to healthy food and creating barriers to unhealthy food actually does create more positive eating habits. And then restorative spaces, that people who have an ability to go to a place to refresh, relax, take a break, does positively affect their ability to do work in the future. Psychologically, there are a number of factors that improve health and well-being. Personalization of space is really important because it allows people to feel ownership of an area or even a desk. Free addressing really works against this. So there has to be some sort of counter to that where people can personalize even though they don't own a desk. Social community is associated with a lot of positive satisfaction. Being a part of something and belonging grounds people. Safeguards against hazards, harassment, and inequities. Lots of literature to support that. Recognition, appreciation, obviously been around for decades. It depends how it's executed. Opportunity for personal and career development, very important, so that people have an opportunity to grow in their skills and abilities. And participation in decision-making is a management technique which allows people to have more autonomy and choice in how they perform work. Control over work demand is one of the key components of avoiding burnout. Again, autonomy and ability to control demand so that they don't exceed personal resources. And then real choice. Employers may say you can have choice A or B, but neither is attractive. And if you, or they're both attractive, but if you pick either one, you're looked as not being a serious employee. So let me talk about the interplay between hardware and software. Now this may seem odd because this is not a talk about technology, but the analogy is very apt. And that is, if you see the physical environment and the rules and policies and so on that exist in organizations, we can call them hardware. They're hardwired. So you have, givens. And then the software is something that you can layer on top of it, which enhances the ability of that hardware to work well for you, or to create new features which provide benefits. So actually the trade-off between hardware and software is really an interesting way to look at this, because if you have a physical environment that's just impossible, no windows, no color, it's dark, all that, all those negative things that really harm people, you can change that with, quote, software, and that is by creating environments, neighborhoods that take a certain theme, and so you actually turn the place into something more fun. And there's a great story of an architect who turned the basement of an old government building that was a stockpile for old metal furniture into a combat zone with his colleagues, and they used to come to work with fatigues on. Anyway, so you can change the perception of hardware through software, and you can use hardware to change the perception of software. So what takes workers out of the workplace? These are all things that have had an impact on people being able to stay in the workplace and perform well. How do we keep workers in the organization and enable their thriving? We need to help workers perform at their best, and the way we do that is to design the most supportive environments. And what are these kinds of environments? They are environments that give workers what they need most. If we know what needs are most important to satisfy with employees in the workplace, we can implement changes that satisfy these needs. And our vision is that we need to have coordinated teams of people within the organization who will work together to create a supportive environment in all the different functional areas of a business, so that their health and well-being can be supported. And it can look like this, where health and well-being and productivity is the primary goal of each of these groups, and you get each of these parties making decisions which promote the same goal and the same objective. And then you don't have internal conflict, you actually have mutual agreement, mutual support, and then I think we can have a workplace that can create a culture of health. And that is it.
Thank you very much for that fabulous presentation. We can spend a few minutes with questions. So if anyone has questions, further questions, please enter them into the Q&A section. But we have a question for Dr. Banks, which asks, do we have evidence that employers actually want workforce sustainability at the outset? Sometimes it appears that they don't.
That's a very good question, because there's few people talking about this, few CEOs talking about this. But if you phrase it a little bit differently in terms of talent management and getting the talent that they need in order to accomplish their strategic goals and objectives, they know that one well. They just haven't connected worker sustainability to talent retention and long-term effectiveness. And I'll just say one more thing about that, which is, and it relates to Dr. Yellen's talk, is that the reason I didn't say that helping people, people getting hurt and injured and therefore becoming disabled and leaving the workplace isn't good for organizations, is because they replace. So it's invisible to them what the wreckage is from their organizational practices. And when they recognize that the talent that leaves because it gets injured, it gets sick, and can't be replaced, that's when I think worker sustainability makes a really good argument. But thank you for the question.
Another question is if you could say something perhaps about the contemporary open office space and the need for privacy, and how did that open office space come about independently of what was known in the research, or I wondered if you could say anything about that.
Certainly. First, let me talk about what is known that is shared in organizations. Much of the literature that I tapped and my team tapped to understand what do we know is in siloed journals, and it doesn't reach the light of day. So many of the things that I talked about today are not known in organizations. So open offices are a response to consolidation of real estate, getting a smaller footprint for the same number of employees. It's often just a cost arrangement. And so what we have to deal with is, when is that appropriate given the kind of work that people do? It's certainly not appropriate when there's confidential work to do, or when there's a lot of interaction between members of the organization and the people who sit in open offices. So when there's a lot of interaction going on, not among the people who sit at the same cube farm, but with people outside, it doesn't work. But when you've got a project team sitting together and you need that proximity, hey, it's not that bad. But think about what are the limiting conditions of where that's a good deal. So given that we're kind of stuck with some open office arrangements, this is where flexible workplaces comes in very strongly, which is you've got to create areas of work environments where there's good focus, concentration, and quiet for the people who need that to do their work. And then there are collaborative, noisy areas where people can interact. And we just cannot say that one size fits all.
Thank you. I think now we're at 11:27, so unless we get any more questions from anybody else, I'd like to say thank you so much for that's very informative and excellent information for us. We have recorded the webinar, and so if anybody wants to watch it, they can register at our coehce.org site, and they will get continuing education credit for that. And please, to complete the online evaluation for this webinar, and you'll be sent the link. And also to just say, our monthly webinar series takes place on the first Wednesday of each month at 10:30 a.m. And next month, on Wednesday, June 7th, we're very honored to welcome Dr. James Craner, who will be talking about the prevention of noise-induced hearing loss. So I don't see that there's any more questions at this time. So again, I want to thank you very much for that excellent presentation. Much appreciated. And thank you to everyone for joining us today. Bye.